pivotal decisions about their patient's care. And one of the most significant recommendations that we make is whether or not patients should undergo surgery and suggesting surgery to our patient. From managing conditions like diabetes, coronary artery disease, carpal tunnel syndrome, to addressing issues like kidney stones or sinus issues. We'll provide insights on how these decisions are made and whether or not you should consider surgery. We'll also answer your healthcare related questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions. I'm Dr. Kamaljit Kaur, and I am a board certified primary care physician here in Coral Springs. Today's first question comes to us from Hazel, who just reached out to us from our Facebook page. Let's see. Hazel asks, "Hi, Dr. Kaur. Is it normal for a primary care physician to determine if surgical intervention is needed for a patient with diabetic neuropathy? I'm asking because my older sister Blanche's PCP said she needs surgery because of her neuropathy issues, and I'm thinking she should probably see an endocrinologist instead. What do you think?" Hi, Hazel. Good for you for looking out for your sister. That's really, really nice that you're there for her and you support her, and I'm sure she appreciates it. Thank you for your question as well. So at the end of the day, primary care physicians are your first line of defense or your first point of contact for your healthcare related issues. While an endocrinologist does specialize in diabetes and is very well versed in managing it, that may not be the case, when it comes to determining whether or not surgery is needed. Now, let me back up and say that the best way to manage any kind of diabetic complications is to manage the diabetes and your glucose levels at the foundation of it. However, if that's not possible, or if unfortunately your diabetes has gotten to a point where the complications exist and they're quite severe, then there's going to be additional intervention that's needed. And your endocrinologist is not always the one to advise on those decisions or to investigate for those decisions. At that point, it would be your primary care physician, and in this case, a surgeon, a vascular surgeon, an endovascular surgeon, or sometimes even a neurosurgeon or an orthopedic surgeon, that combine their assessments with your primary care physician to really determine whether or not moving forward with surgery is in your best interest and how effective that surgery is going to be in treating your symptoms. Because remember, we're doing all of this, or we would be doing all of this in order to better manage your condition and to relieve you of your pain and to help you live a healthy, long life. Now, not everybody is a candidate for surgery, and this is where your primary care physician comes in. They're the ones that are going to sit down with you and do the testing and the analysis that's necessary to determine whether or not you're a candidate for surgery and whether or not it would be beneficial for you. Now, many people do benefit greatly from nerve decompression surgery, which is essentially the surgery for diabetic neuropathy. But like I said, not everybody is a candidate for it. So do check in with your PCP and, with Blanche's PCP, and see what would be the best course of action for her. Now, the next question we have is from Phineas, and Phineas reached out to us through our YouTube page, and he asks, "Hey, Doc, I just turned 30, and I think I'm the only one of my friends who's never had their tonsils taken out. My throat is currently sore and my glands swollen. So I'm wondering, what are some of the symptoms of tonsillitis that would indicate it's time to take those bad boys out?" Hi, Phineas. You've had a nice run, but it actually might be time to, as you said, take those bad boys out. Before I share my thoughts, though, let's check out this video from our partners at the Cleveland Clinic. Now, Phineas, back to your question. Now, this question actually hits very close to home for me because I myself have chronically enlarged tonsils, and I've had a few bouts with tonsillitis as a child. Now, there have been times where I was told by my pediatrician and then my primary care physician that, hey, you should probably get these taken out. But there were also times when my primary care physician advised against it because really I wasn't having that many symptoms and I wasn't having that many bouts of tonsillitis. Now, let's back up a little bit. What are the symptoms of tonsillitis? Let's go through them. Some common signs and symptoms of tonsillitis are number one, the one that we probably are all most familiar with, red, swollen tonsils, which can cause a lot of irritation and a lot of pain. Number two, white or yellow coating or patches on the tonsils. And I know some of us who've had tonsillitis in the past are familiar with that one. Number three, oh yeah, sore throat. I mean, that's one of the hallmark symptoms of tonsillitis, right? Number four, difficulty or painful swallowing. Now, this can occur if your tonsils are really red or swollen, they're really irritated, and they're causing inflammation in the throat area in general. Number five, you can also get a fever just as with any other infection. Number six, enlarged or tender glands, which are lymph nodes in the neck area. You also have some that are behind the ears, but predominantly you're going to get the ones in the neck that get swollen with tonsillitis. And number seven, you can also have earaches because essentially your upper respiratory system, which is your nasal passages, your sinus passages, your throat, your ears, they're all kind of like a plumbing system. So if there's something going on in one, chances are the other's going to be affected. And then number eight, chills, which comes with any kind of an infection, and especially if there's a fever, it's your body's way of fighting and trying to resolve that infection. Now, if you have a bout or two of tonsillitis, you're likely not going to be advised to have them removed. However, if you experience tonsillitis repeatedly, then it actually may be the best course of action to get them taken out so you're not experiencing those infections repeatedly. Another thing that people may not know is that if your tonsils are large enough, they may actually impede your breathing, especially when you're laying down. Because think about it, when you're laying down flat, your throat, just, gravity, some things tend to compress a little bit. And if you have tonsils that are really large, they're going to further obstruct your airflow into your throat and then eventually into your lungs. So that can also be another indication for getting a tonsillectomy or removal of tonsils. Now, whichever path is the safest and best management for you, please do discuss that with your primary care physician. All right, we've got our first question from allhealthtv.com, and that's pretty cool because that's our website. There's a lot of information there, so if you haven't visited already, I encourage you to go log on and just scroll through. Now, this one comes from Dorta, and Dorta asks, Dr. Kaur, my husband Albie has developed a lipoma on his neck. Our doctor has suggested that Albie have it removed because it's near one of his glands. I don't mind that Albie is getting rid of it since it's kind of unsightly, but what exactly is a lipoma? Hi, Dorta. Well, a lipoma, even though it could look scary and it looks like a tumor or looks cancerous, it's actually benign. And benign means it's really harmless. It's not going to really do much. It's not going to be detrimental to your overall health. Now, it is a fatty tumor, and in layman's terms, that's what we call a lipoma. But I don't want that name to scare you because, like I said, it is a benign thing that tends to happen. Why does it happen? Unfortunately, we really don't know. There can be some genetic causes of it, but we haven't pinpointed one reason or another that causes lipomas. Now, even though there are some genetic factors that contribute to the development of a lipoma, there's also specific genetic conditions that are passed through generations and families. And in those times or in those situations, you don't just have one lipoma, you might have several lipomas in your arms, your legs, or throughout your body. But either way, if you feel like you have a lipoma, get it checked out by your physician, of course, because first of all, we want to make sure that it truly is a lipoma, that it truly is a benign fatty tumor. And the best way to do that is, well, first we get imaging. So sometimes an ultrasound, or if further imaging is needed, a CAT scan or an MRI, whatever your doctor determines is best for you. Once we have seen what it is, and we can classify it as a lipoma, the next question is, well, what do we want to do about it, right? And if it's not really bothering you, if it's small, if it's in a space that's not really, it's not touching on other organs or nerves, it's not causing pain, and it's not unsightly to you, then really we leave it alone, because if it's not broke, why fix it, right? However, there are certain instances in which a lipoma should be removed. And some examples of this, and in your husband's case, is if it is on a structure, on a nearby structure, and limiting or impeding the functioning of that structure. So if it's by a gland, it might eventually encroach on that gland, causing inflammation, irritation, pain, and even limit the functioning of that gland. So yes, that in that case, that should be taken out. Now, some other reasons to have a lipoma removed are, if it honestly, if it doesn't look nice to you, and that's not wrong. I know a lot of people might think it is, but say you have a little lipoma here on your wrist or on your arm, and it's a minimally invasive procedure to take it out. You obviously want to do this with a certified surgeon who knows what they're doing and is comfortable taking it out. And then you want to make sure that you having that surgery doesn't pose really a high risk. And if those factors are all positive, then getting it taken out just because you don't like how it looks is perfectly fine. After all, looking good helps us to feel good, right? And if it's something that's cosmetic, there's no harm in getting it checked out and removed. But you should do this with the analysis and approval of your primary care physician and surgeon. Now, in case you missed it the first time, here's how you can send us your healthcare related questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So our next question comes to us from a YouTube viewer. Thank you so much for sending this in. And this comes from Klaus. Hi, Klaus. And Klaus's question is, doctor, no disrespect, but is it okay for a primary care physician to evaluate the need for surgery in patients with heart murmurs and heart arrhythmias? Well, I understand your question, and I completely understand your concern there, Klaus, because traditionally, anything to do with the heart, we think, or we assume, I should say, sorry, that the cardiologist or the cardiothoracic surgeon is the first place we should go. While that may be true for a lot of conditions, certainly your primary care physician can be your first point of contact and your first conversation to determine, is my heart murmur or arrhythmia significant enough that I need to have surgical intervention for this? And while many people assume that PCPs may not know the right answer to that, we are now very well versed in heart ailments and can certainly help you make that decision and then refer you to a cardiologist or a cardiothoracic surgeon that can further guide that decision. Now, as your PCP, we do work very closely with that specialist to determine, is this heart murmur or is this arrhythmia having an impact on your overall health, having a negative impact on your overall health? Because that's always the number one concern. And that's always the number one reason for us to say, okay, we need to have surgery. If the impact is minimal, then we just advise that we monitor it. Maybe we do some testing every year to make sure that your heart function is not affected. And we might also maintain you on some adequate medications and then monitor you on that as well. However, certain heart arrhythmias and certain heart murmurs are actually caused by underlying heart conditions that can get severe. And sometimes that would require surgical intervention. In these cases, while it is usually the cardiologist who makes the decision to move forward, it's going to be your PCP who's your first point of contact and really who's going to determine, are you strong enough to undergo surgery? Is this the appropriate surgery? And how are you going to recover from that surgery, especially if you have other health conditions going on? Because going into surgery and undergoing surgery is one thing, but then recovering from it can be a totally different thing sometimes. So absolutely, your PCP is the foundation of determining your surgical risk. So do check in with them. All right, friends, we're going to take a little detour here and veer away from the surgical questions for a moment. We have another question from YouTube, and this comes to us from Edna. And Edna wants to know, hello, doctor. I got a real head scratcher here. I've got some kind of breakout on my arms and chest that's itching intensely. It started with an itch and then turned into raised up red spots about the size of a nickel. The three docs I've been to have no idea what it is. Dr. Kaur, can you help me? Edna, I'm so sorry to hear that you're going through this. I know it can be really frustrating to have something going on, no matter what symptom it is, and not know what's causing it and not know how to treat it. So my first theory is that you're experiencing some kind of an allergic reaction. Now that begs the question, to what? An allergic reaction is one of the few conditions that we treat without knowing its cause. And we do that because we don't want it to get worse and we don't want it to get complicated. Now, our immune system is a very complex system. And one of the reactions that it has to an outside, we call them allergens, or to an outside substance, is to have an allergic reaction. And basically, that's your immune system reacting to something foreign that it doesn't like, and it's trying to protect you, really. But in the complicated pathways of our immune system, that allergic reaction can be something as simple as the red rash or the red spots that you're experiencing. And that can actually progress to something more serious and even become more life threatening. So this is why we try to, nip it in the bud to say, and we try to get it taken care of as soon as possible. So we might even treat it without knowing what's causing it. Now, once we treat it and you're feeling better, or we're seeing that the symptoms are starting to go away, and we can do that with antihistamines, sometimes steroids. Once you're feeling better, then the next step is to determine, okay, what caused her to have this reaction and how can we prevent it in the future? So you might be referred, your PCP might actually do some allergy testing on you. And from there, we can determine, do we need to send you to an allergy specialist, or do we have enough information to figure out what you were allergic to and how you can avoid it in the future? Because like I said, it can be worse. So if today you have some red spots as a reaction to an allergen, the next time around, it can actually get worse and it can actually get life threatening. So if we figure out what you're allergic to, we want you to avoid it for sure. One thing about allergies, and I learned this, obviously as an adult, as I was going through my medical training, is you're not always allergic to things from day one of being born. You can develop allergies at any point in your life cycle. And actually, you can be allergic to things as a child, and then as an adult, you're not allergic to them anymore. The whys and whats of this are still unknown to us, but it's kind of it's kind of what we see happen. So we do tell everybody, you may not be allergic to peanuts today, but if you develop an allergy tomorrow, it's not really unheard of. So to get to the bottom of it, you definitely want to check in with your primary care physician and maybe, depending on your symptoms, even see an allergist. Now, there's also instances when the symptoms that you're having aren't really an allergic reaction, but an autoimmune reaction from an autoimmune condition. Sometimes with viruses can also cause rashes and red spots. So in those cases, it's necessary to treat the actual condition that's causing it. So the autoimmune condition that's causing it, and or uh, the autoimmune condition that's causing it, or the virus that's causing it. And then once we take care of that, then the symptoms should go away. All right, and we have another question from our YouTube page. It's very popular today, I see. And this one comes to us from Ping, and Ping asks, so I've been doing a lot of freelance writing these days because of the current gig economy. Unfortunately, my ergonomically correct desk, chair, and keyboard aren't helping with my carpal tunnel pain anymore. I know you're not a hand and wrist specialist, but I value your opinion. Should I get some prescription medication or maybe surgery? Hi, Ping. Thank you for sending in this question, and thank you for your kind words and entrusting me and my opinion. Now, this one really hits close to home also because I didn't undergo carpal tunnel surgery, but my mom did. So she had symptoms for a little while before her PCP and her surgeon decided together that she would benefit from surgery. Now, as far as carpal tunnel goes, I like where you're going with this. You have an ergonomically correct chair, desk, and keyboard, and that really is important in ensuring that the carpal tunnel is not compressed, because when this area is compressed, whether you're on your mouse all day or you're typing, even any other job that requires you to have certain repetitive movements and those movements compress this area, that ends up compressing a nerve that runs through here. And that's what gives you the carpal tunnel tingly, numb symptoms that you experience in your hands. Now, generally, when a patient comes to us and says, hey, doc, I'm having these symptoms, we don't say, oh, surgery right away. But we want to treat it conservatively as much as we can, because surgery does come with its risks. Even if it's a minimally invasive surgery or a surgery that's only going to be 10 minutes, it still comes with a little bit of risk, and we want to avoid any unnecessary risk in our patients. So what do? Well, we might advise you to take anti-inflammatories if you can take them. We might advise you to relax and stretch the wrists. There are certain stretches that you can do on a daily basis. And we might advise you to wear a splint during sleep at night so your arm's not going, your wrist's not going like this during sleep. Also, if you can, our preference and our best recommendation to somebody who has carpal tunnel syndrome is to stop doing the thing that's causing it, right? But I know with work and job responsibilities, that's not always possible. So we recommend the other items to do. Now, if we do those other things, the anti-inflammatories, the splints, the stretching, and even if we do try to avoid the stressful activity from time to time, and all that is still not helping, and it's been months or even years sometimes, at that point, you want to let your primary care physician know because that is our signal to say, hey, I think we need to go to surgery now. So let's talk to a hand and wrist surgeon and get their opinion. And at that point, we would refer you to that specialist and they would sit down with you, maybe do some x rays or MRIs, really see what's going on. And then, depending on that, they may or may not recommend surgery. Remember, you always want to undergo surgery with a low risk of complications when possible. And the recovery from carpal tunnel is pretty straightforward as far as surgeries go. I remember my mom had to do several weeks of occupational therapy just so she could do the movements again and regain her strength in that wrist. But today she's, back to her normal and sprightly self. So always check in with your doctor first and do follow their recommendations because that's how you're going to heal the best after surgery as well. All right, looks like we have another question from our Insta page from Instagram, and this one is from Yezel. Now, I'm going to admit I'm not 100% sure that I'm pronouncing that correctly, but I feel like it's a beautiful name, so apologies, but Yezel, thank you for sending in your question. All right, Dr. Kaur, I'm something of a chocoholic, so I've had the occasional bout with kidney stones before, but not like this. The pain is so severe, I feel like I'm giving birth, and I'm a guy. I've heard that if a stone is too big, they occasionally perform surgery. Is this true? Well, Yazel, I appreciate you sending in this question, and I never want to tell somebody to stop eating a food that they really, really like. But let's try to minimize that chocolate and maybe replace it with certain fruits and vegetables. It'll be good not only for the development of kidney stones, but also so many other health conditions. Now, as far as big kidney stones go, they can sure be a pain. And yes, I have actually heard that passing a kidney stone can sometimes be more painful than giving birth. So I really feel you on this one. Now, determining whether or not we're going to operate on a kidney stone involves a lot of factors. For instance, size, if it's too big, the location within your urinary tract. So, is it in a location where it's impeding the flow of urine? Because if it does that, not only is it going to be difficult for you to urinate and get those toxins out of your body, but that might actually predispose you to urinary infections. And that obviously can be, dangerous if that's not taken care of quickly. So if you're getting repeated infections or UTIs and you have an obstructing stone, they might advise that you get it taken out. And the best way to treat a kidney stone is to prevent it. So like I was saying a little bit earlier, if you can minimize taking in minimize the amount of chocolate that you take in, that would probably be the best. Remember, always stay well hydrated. You want to make sure you're drinking enough water. And yeah, pretty much just check in with your physician, get an eye on those stones, maybe get some imaging done to see how big they are and where they are, and then they can make a really educated recommendation, and then you can make a decision on how you want to move forward. Now, just in case you missed it the first few times, here's how you can send us your healthcare related questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So our next question comes to us from YouTube, and this is from Zelda. And Zelda asks, hello, Dr. Kaur. I come from a family of sinus sufferers. My great-grandparents in the old country, my grandparents who came through Ellis Island, and good old mom and dad. How do you decide when a patient with sinusitis or other sinus issues needs surgery? Zelda, thank you so much for sending in your question. And this is something I see quite commonly. Now, whether it's because you have allergies or you have a nasal polyp or you have enlarged tissues in your sinus passageways, there may be times when people experience sinus issues. It's kind of a broad term, but there's a lot that can happen in your sinuses. And just like other surgeries, we want to make sure that we're giving you the right recommendation. So we're going to recommend surgery if your symptoms are severe enough. And if they are, then you would benefit from surgery. You want to talk to your doctor and make sure that you can undergo it safely and that you're going to recover from it just as safely and get your symptoms treated, of course. Now, other factors that you want to determine is, well, are you somebody who keeps getting sinus infections? Because then, yeah, you want to get sinus surgery and maybe, get things cleaned out, we like to say in the industry. Is it affecting your smell or your ability to talk? So, you definitely want to take a look at all those factors and ask your doctor, hey, do I really need surgery? It's been a lot of questions today about surgery, and we talked about different types of surgery. But the point of the matter is you always want to check in with your PCP. You want to make sure you can undergo surgery safely and that you're going to recover well and that you have all the resources that you need to make an educated decision. Well, folks, it's been great. I've loved answering these questions for you. I hope you've had a good time as well. We'll see you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.